Welcome to Deuk Spine Institute. Our patient has piriformis syndrome. This is a torn muscle in the buttock. The muscle is called the piriformis muscle. It attaches from the tailbone over to the hip on both sides. You have a left and a right. She's torn both muscles. She's having horrible pain in the top of her buttock. That pain radiates down her leg and sciatica because the sciatic nerve actually runs through the muscle in most patients. And inflammation of the muscle will cause inflammation of the sciatic nerve. All right, let's bring the fluoro in and we're going to get started. Our goal is to get rid of the piriformis pain by releasing the muscle, causing the muscle to relax and stop hurting. It's called the piriformis muscle release. It was discovered by people much smarter than me. I just changed the way it's done and made it less invasive and safer and more effective. South? All right. So you can see the tip of the probe, shot, is exactly where the muscle attaches. And you can see the muscle there. Show us the muscle. Nope. It's actually right along. Nope. Lower. Right along there. Go straight up. There we go. That's the muscle. You can kind of see the grayish of it.
We can see it, yes.
Yeah. So I'm going to release that muscle off the hip. And by doing that, it gets rid of the piriformis syndrome and it gets rid of the patient's pain. We've been doing this procedure now. We've done over 150 of these surgeries at Deuk Spine. Our success rate is 100% elimination of piriformis pain. We've never had a complication. The truth is, this muscle is unfortunately just a pain in the butt. It doesn't really do much. It's called an external rotator of the hip. It moves the hip out, rotates the foot out. We're done with this side. We're going to go to the other side. Let me staple. If you have any questions, feel free to ask, but we've already released one piriformis. We're about to release the other. This technique was pioneered by myself here at Deuk Spine. We were treating piriformis syndrome for years and years and years, and every time we did a shot, the patient would feel better and then come back again, within a few weeks, and their pain was back. We did Botox, we did epidural, we did steroids, we did, so many, put some medicine there. We did PRP and stem cells, and it doesn't matter what we injected in the muscle, the pain always came back. So we started to refer the patient out for piriformis release. They went to the orthopedic surgeon. He did a horrible job. He would slice them open, cut their butt off. They would have a huge sunken area on their butt muscle, and they would still have the same pain because it's hard to do that surgery. So I figured out by studying the anatomy for a long time that there's a way to do the release that's less invasive and more effective. And so I started doing them here at Deuk Spine, and the results have been phenomenal. We've been able to cure basically 100% of piriformis syndrome with this 4mm incision. Shot? All right. So the piriformis muscle attaches to the top of the hip. It attaches to a little area called the greater trochanter. The greater trochanter is a bone at the top of the hip. I'm actually touching it right now with whoops, hold on. It's slippery, by the way, very slippery bone. We're done in 5 minutes. It's a very slippery bone. Hold on. I'm going to see. Here we go. Shot. Right there. And hers actually has a little projection. You guys see that? That's not normal. It's some calcification of the muscle. So I'm going to release the muscle right here. And by doing that, that's going to take away her buttock pain, and it's going to take away her sciatic symptoms that she's having. And it's a godsend because when you go to the doctor with sciatic pain, the doctor's always looking at the spine thinking, you must have a pinched nerve. But that's not always the case. The most common cause for sciatic pain in your leg is, of course, a pinched nerve. But what a lot of people don't know is that the piriformis is the second most common cause of sciatic pain. And when you have a torn piriformis muscle, it just never heals until you have a release done, like we're doing right now. All right, so that should do it.
We have a question
Yeah.
coming from Faisal once more on Facebook, asking, Doctor, is dura inflammation called arachnoiditis? What scan can show this, Doctor?
Yeah, dural inflammation is not called arachnoiditis. Inflammation of the arachnoid is called arachnoiditis. The dura is the outer covering. It's a thick white covering that's outside the nerves, but the arachnoid is the next covering under the dura, and then there's one more called the pia. So arachnoiditis is inflammation of the arachnoid. Are we good?
Yes, sir. Thank you.
All done. 4 millimeter, 4 millimeter, 4 millimeter, 4 millimeter, facet, SI, bilateral piriformis release. I expect her pain to be gone, and it's a bloodless surgery. It takes, it took us 30 minutes. Thanks for joining us. Any other questions?
No current questions.
Have a wonderful afternoon. We'll be back for one more surgery, which is a... Oh, we're done. I thought we had 6 today.
No, Thursday.
Thursday's 6. All right, we have one tomorrow maybe? Did they put one on for tomorrow? All right, so we might have one tomorrow, but then we got 6 on Thursday. So we're done for today. So we'll see you tomorrow maybe at 1 o'clock Eastern Standard Time or Thursday for 6 surgeries. Have a nice evening.